In this example, we'll begin by acting as a patient. Starting on the Foundation website homepage, we're going to submit a Get Help for Any Health Problem form. So we'll navigate to Appointments, then click Request an Urgent Appointment online. We'll come to a page of information about the form, noting the care card to highlight any high-risk symptoms and emergencies for which the patient should call 999 or go to A&E. Before clicking Start Now to proceed. We'll complete the online form using our basic information. The full name, date of birth, sex, postcode and phone number are all mandatory to enable patient verification through PDS. When a match is found in the spine, the online consultation will be able to be sent directly to the clinical system via the unique NHS number. The email address is also required to enable patient replies via the online consultation dashboard. We'll continue to fill out the Get Help form. Note the mandatory acknowledgement that the problem is not an emergency and the patient will call 999 or visit A&E if their symptoms worsen. We submit the form and are shown a confirmation message on the web page letting us know the practice will respond. Now swapping over to the patient's email inbox, we can see that we've received an automatic confirmation message from the practice, which can be viewed by clicking the link in the email and confirming the date of birth that matches our submitted form. Here we'll see the automated response message, along with a copy of our original form submission with time and date stamps. We can close this window and wait for the practice to respond. Now we'll take the role of a practice staff member, in this case a doctor, who deals with all clinical forms such as Get Help for Any Health Problem. We'll log into the dashboard using our unique username and password, accept the disclaimer, and then arrive on the dashboard homepage. Here we can see the Get Help form immediately visible in our work list. It's also visible in the new request list, which can be seen by everyone who logs into the dashboard and shows every form that's submitted via the Foundation website. However, the practice has set up a group of doctor staff users that certain requests are set to automatically filter to. We're a member of this group, so we can see the Get Help form in our work list separated from all other lists, thus making the workflow more efficient. We'll click on the patient name and see the full details of their request, including the request history on the left, patient details on the right, the full questionnaire is filled out by the patient, a copy of the automatic response which was sent out, as well as the time and date stamps and tracking of the patient opening and reading the message. We can reply to the patient to let them know we'd like to see them for an appointment. We'll click Reply and can manually type our message or use one of a set of saved templates called Quick Responses that the practice have created. We'll select the appropriate template, which populates the reply box with a fully personalised message, and can also choose to allow the patient to reply back to the thread here, as well as attach files into their reply. We'll then proceed to send our message. Now swapping back over to the patient's email inbox, we can see that we've received a second message from the practice, which can be viewed by clicking the link in the new email and confirming the date of birth that matches our submitted form. Here we'll see the practice's reply message, along with a copy of our original form submission, automatic acknowledgement message, with time and date stamps. We can use the Reply to Practice option to clarify anything with the practice, and then close this window and wait for a confirmation of our appointment.